Hello everyone, I'm Deborah Garlick from Henpicked Menopause in the Workplace and author of the book Menopause, The Change for the Better. And I'm delighted that you're here to join us today. Today's topic is a very, very popular one, herbs for the menopause. So whether you choose not to take HRT or whether it's for medical reasons and you're looking for herbs because you're still experiencing menopausal symptoms, we will explore all of that. And I'm delighted that we have Dr. Marilyn Glenville with us again, back by popular demand, and she'll be able to tell us all about this. She's an absolute expert. So I'm going to jump straight in then with Marilyn and say, what herbs are helpful for us during this time of our lives?
Well, there's some really good evidence from the medical literature, and it also depends on what stage the women are, because certain herbs are more beneficial depending on whether they're in the perimenopause or the menopause. So if we think about the perimenopause, and obviously that's the lead up, and the hormones could be fluctuating quite wildly. And for some women, it's more the mood swings, irritability, anxiety before the hot flushes and the night sweats hit. And then I would think of a herb like Agnus castus, which has a balancing effect on hormones. I do use that also in younger women who have irregular cycles and are maybe trying to get pregnant or want to regulate the cycle generally. So it's a really good herbs when the hormones may be going all over the place, as they are during the perimenopause, and where the symptoms could almost feel like magnified premenstrual symptoms, that Jekyll and Hyde, that irritability, anxiety, where it's more those kind of mood swings than the hot flushes and the night sweats.
Sorry, what was the name of that herb again? I didn't catch it. I don't think it's what
called,
I've seen.
It's called Agnus castus. It's also called Vitex sometimes. I use it a lot for younger women to regulate the cycle, and use it also for premenstrual symptoms when it is like Jekyll and Hyde, the mood swings. So that's a very good herb during that perimenopause time, when it is more it could be the mood changes before it gets to the hot flushes and the night sweats.
Oh, that's very interesting. So, it can actually cover a range of symptoms then.
Yes, and we think of it as classed as an adaptogenic herb, which really means it's got a balancing effect, and particularly a balancing effect on hormones. So it does help a lot of times in any stage in a woman's life where the hormones may be out of balance, but particularly as we're talking about the menopause stage, then very good for that perimenopause time, that lead up before the hot flushes and the night sweats hit, and before the periods stop completely.
I'm sure we're going to come up with a huge list of all of these, like a sort of a directory of. So
Yes.
that's the first one. Then if you're starting with A's, you've got as salad, cactus. So that's one of the herbs. So it was interesting that you were saying about different stages.
Yeah.
Of life. So that was the perimenopause. We've just had a question as well about how often would you take that and how long would you take?
Well, it's interesting with the herbs. My recommendation is take it until the symptoms go. Very different. And I work obviously with food because I'm a nutritionist, and vitamins and minerals. And they're very different because they're trying to work on our general health, keep us well, keep our energy up, and keep us well for the future. The herbs I'm using to address problems that are happening at the moment. And then once those have gone, for instance, those hormones have got back in balance, then those herbs could be stopped. So this doesn't have to be a long-term thing. Whereas for me, taking a multivitamin and mineral is long-term because I want to maintain my health into the future. So we use things differently depending on what somebody's goal is and what they need at the time.
Thank you. So we'll focus on the herbs, but remind me to come back to the supplements, because that sounds like that's an interesting one as well.
Yeah.
So you've covered one. Are there any other sort of, what are the other herbs that?
Yes, and the other one I would say would be the herb of choice would be black cohosh. And that's got a lot of evidence in the medical literature for what they call the vasomotor symptoms, hot flushes and night sweats. And I found over the years in clinical practice that actually it's better to use a combination of herbs rather than single ones. I know I mentioned Agnus castus, but I would often put a number of herbs, use them in a combination, because we're all sensitive to different things. And I've had a situation in the clinic where two women could come in with identical symptoms. They both take the same herb, and one comes back and says, that was absolutely brilliant. And the other one says, well, that didn't actually make a difference. And so it's that sensitivity. And sometimes then when you use a combination, it's going to be more effective quicker for that woman, because we're going to be mixing, and there's a synergistic effect between the herbs as well. So it just makes it faster for her.
Right, okay. Any other herbs?
Yes, there's quite a lot also. Again, I would use a combination, things like hops, which I remember in one of my talks when the lady said she was just going to drink more beer, and I suggested that wasn't my recommendation. But yes, again, good clinical research on it. Wild yam also, red clover's had good research, and a herb that is not directly working on, the symptoms that we're thinking of would be milk thistle. And any hormonal changes that we have during our life where they may be causing issues like premenstrual or polycystic ovary syndrome, then milk thistle is always important, because it's the herb of choice for our liver. And any hormone transition we're going through, or any imbalance, it's our liver that's got to metabolize the hormones into a harmless form before they get excreted out of the body. So it is important that our liver's working effectively all the time, but particularly when we're going through a hormonal transition. So I would include that herb anyway, even though it's not directly for the symptoms.
I see. So that sounds like it to be particularly helpful for a hangover, and for somebody that's hopping their herbs, hopping hops through drinking ale or beer or something.
And a lot of people use it when they're detoxing. If they go, they want to do a bit of a spring clean and they want to just clean up their diet and think about detoxing, then yes, they would often add milk thistle in for the same reason.
Okay, and what about sage? We hear about sage a lot.
Yes, and there's been some really good research on that, and I put the statistics up to remind me. In one of the studies, it decreased hot flushes by 50% after 4 weeks and 64% after 8 weeks, and particularly a nearly 50% reduction in, again, those perimenopause symptoms, which might be the anxiety, the tension, the insomnia. So yes, women could take sage tea, they could use it as a tea, but if the symptoms are strong, then I always suggest they have it in a powdered capsule form, because it's going to be more concentrated. But they could use the tea alongside it as well, wouldn't be a problem at all.
So we can get a list together of the ones that have got the most benefits during perimenopause.
Yes.
That would be very, very helpful. But you mentioned some of the statistics around the effectiveness of you were focusing on, particularly on red clover there.
Yeah.
How much research is there on herbs? And I know nature provides us with lots of benefits, doesn't it? But are there the studies on herbs in the same way that there are in HRT?
There are some good studies, yes, and obviously more came out after the Women's Health Initiative study came out. I think it was 2002, when there was an issue concerning HRT and breast cancer. So then I think the scientists were thinking, if women aren't going down the HRT route as much, we need to look at the herbs, make sure they're safe, make sure they're effective. I will say that they're not as effective as HRT. They're not, because it's not a medication. And so for some women, they might need something stronger like HRT because of the symptoms. But I would always suggest, if they felt like doing it that way, would be to try the natural approach first and see how effective it is for them. But good studies, and yes, good studies on the effectiveness and also the safety of them as well. And like you said, that's really important too, that we have that from the medical literature, that we know what we're recommending is actually useful to take, is beneficial, and also safe as well.
And safety is key, isn't it? Because, many of us will look on these herbs, and you use the word the natural approach because it is nature, but they can have side effects, can they?
Some of them could do. There was an issue a few years back with black cohosh, and so it has something you have to put on the side of the label. But the issue was that it wasn't the Native American form of the black cohosh. It came in from somewhere else. I think it was a Chinese version. And so it wasn't the right herb. And that's why, if people do it with really good companies, with integrity, have that confidence, then there isn't the issue. And I have to say, in the over 30 years I've been in clinical practice, I haven't had any issues with the herbs at all. We know there will be some herbs where there will be contraindications, like St. John's wort and certain medications. So we're always aware of that. But once you've got the right herb and you know somebody's not on a medication that would be contra to it, they're absolutely fine and work really well.
So contra to it, as in have an effect on that. So
well, a contraindication would be with St. John's wort. If somebody's taking another medication, it wouldn't be wise to take the St. John's wort, but that is quite clear when you do that. But there isn't those issues with the herbs we've talked about at the moment.
Thank you very much. And a couple of things that you mentioned there, because now I'm getting into the, okay, if we've got a list of these could be helpful. And you mentioned labels.
Yes.
How do you tap in? Because you mentioned about you use a variety of, and mentally I'm now thinking people are going to go to the health shop and look for everything that you've mentioned and put them all in the basket. That's not necessarily a good idea, is it?
No, and what happened for me in clinical practice was I couldn't find the quality and the combinations that I wanted. So I formulated some specifically for the natural health practice that have got the combinations that I want to use in the clinic. And also for me, it's what else is in that supplement that's important. So I always suggest going for capsules if possible, because then if you've got a tablet, something has to be in that tablet to bind it together. Sometimes it could be talc, which is what one lady bought her supplements into the clinic, and that was what the binder was, holding the tablet together. And they can also put excipients in there. So these would be non-active ingredients that are put into a supplement in order to help it flow more smoothly through the machinery. So they could be lubricants, anti-canking agents, and they have no benefit for us for taking them. They're there to speed it up through the process. So I'm hoping that people who are listening will look at the ingredients on their food and thinking about, taking out artificial sweeteners, colorings, preservatives, and do the same on anything else you buy, whether it's a herbal combination or whether it's a supplement, that you don't want things in there that aren't needed and what you would avoid normally in food, because in certain things, supplements, there could be artificial sweeteners or colouring. So it's making sure that it's a really clean product and you've just got what you need within that capsule and nothing else added in there. And I think that's really important.
Thank you. And I know we'll share a link to your to the website that you mentioned, so that people can have a look in there. But how do you get a consultation? Do they come ready mixed, or do you have to decide which ones are right for you?
Some are ready mixed, and they're when the symptoms are very obvious, and they'll see on the natural health practice site the ones that are ready mixed. Sometimes, though, we do have them made up specially if there are certain things which are more specific to that person, but otherwise the combinations are really good, particularly for the stages that we're talking about today. It would only be if somebody's got things like polycystic ovary syndrome, fibroids, endometriosis, heavy bleeding, where we may work in a slightly different direction because it's something more specific than the perimenopause or the menopause itself.
And with that, because we often say talk to your GP if you're experiencing symptoms. Is there an equivalent from a herbal perspective in terms of a consultation? Because I could get very lost in all of these herbs.
Well, oftentimes nutritionists will work with herbs as well, which is what I do. There are herbalists also who work specifically with herbs. So yes, we do have those specialities available for people who want to work in that direction. For me, always, it's about combining nutrition, food, nutrients, as well as herbs as well, because I think for me, it's always that our food is the foundation of our health. So that has to be in there. And will be women who are happy to stay on HRT, and it's still about getting their food and what they're eating completely right. So that's really important. So for me, it's always about the nutritional side, and then adding in whatever else is needed to help that woman through this stage in her life.
That's wonderful. So if you're looking for an expert to give you advice, what would their qualifications be? What would you look for if you were Googling for one in your area?
Well, it would be that they had a nutrition qualification if they want to combine that, or they'd have a herbal qualification, and you can see, where they studied, and that would be important. For me, there's also an association, a British Association for Nutrition, which they could click on and find a practitioner in their area. I have to say, though, I mean, obviously I'm biased, but my clinics, we usually are in Harley Street and also Kent, Ireland as well, but we're all working by Zoom, so it actually doesn't matter where anybody is. And we've been working like this for the last 2 years, and all the functional medicine tests and everything else, we've been able to operate just the same. So we've got women in Spain talking to us, America, Australia, so actually it doesn't matter. And if they go to glenvillenutrition.com, they'll see all the information about the clinic.
Absolutely. So you could have Dr. Marilyn Glenville PhD sitting in your living room, guiding you through the places. Thank you. We do look for those qualifications because, self-medication, whether it's from your health shop, it's the same. You don't really want to be going. You want to be informed before.
Yeah. And also, I've seen women in the clinic where actually they've almost felt something isn't working because they've tried one thing after another. And actually, if they'd had the right advice, we could have actually cracked it much earlier. But they were just trying things on their own. And they then felt like they were almost giving up. But, once you get the right effects and the right combination, yes, then you've actually made such a difference. So you don't really want to go down the trial and error route in case it doesn't actually work at the end, and then it feels a bit disheartening about it all.
Well, I'd say that's probably also a costly route. Because
it is costly. Yes, you're right. Costly and time consuming when somebody's wanting to, make a change to their health faster because the symptoms are uncomfortable. Yes, you're right. It's costly and time consuming.
I know you have the initial cost of the consultation, but then at least, I mean, even if you're getting your herbs at a discount for a 2-for-1 or something like that, it's still costly, and it's costly to your health as well. So you get talk to somebody that is a specialist and have a consultation first of all. But there will still be those that do go and look in the health shop. So is this something, you mentioned labels? Is there a sort of like a kite mark for certain herbs?
There are some that are licensed and they could see that on the label. Combinations for me are better and they might not have that on there. It would just be looking at whether there's anything else added in there, what the quality is like, and also the amounts of the herbs would be important too. So I think it would just be a bit of a label reader and make sure there isn't anything else added in there, like colorings or sweeteners or something else that really you wouldn't want in your food, and you really wouldn't want in a supplement either.
So I should really bin my gummy bear vitamin Ds then, shouldn't I?
They might have sugar in, or they might have yes, and you're right. If something needs to be chewed, or whether it's going to be a liquid form, it will often have something in it, like sugar or an artificial sweetener, that actually wouldn't be the best way to go, because we wouldn't want that in our food if we're trying to keep the sugar content down, and you definitely don't want it in a supplement.
Wonderful. So while we're on supplements then, because as a post-menopausal woman, I still have to say I still do feel the trials and tribulations of ups and downs. I'm wondering when I might get to a straight line, to be honest. But what supplements should be on my list? I use the word should, we're not here to sort of say you should be doing this, but what would be good for me?
And that's a really good question, because we've talked about herbs, Deborah, that for some women, they can't take HRT, or they made a decision that they don't want to go down that route. And we don't mix herbs and HRT at all. So if a woman's on HRT, she doesn't need the herbs, because the herbs, the HRT should be doing its job. And that's the difference. Supplements and vitamins and minerals are very different. And a woman who's quite happy to be on HRT and it's working really well for her, and those who can't take it or don't want to take it, the vitamins and minerals are important and very different to the herbs. So they're about keeping us well generally. For me, I think of them as my insurance policy when, you know, I might be out and about and can't get something that I would really choose in terms of that quality. But I would suggest that, first of all, they have a multivitamin and mineral that's designed for the menopause. So it's got everything in there, including all the nutrients and the antioxidants, plus those for our bone health as well. Things like calcium, magnesium, D3, and also the one I use in the clinic's got digestive enzymes in there, because unfortunately, as we get older, our digestive system isn't as efficient, and we need it to work as well as possible for our bone health and prevention of osteoporosis. So that would be the top one. I'd also think about omega-3 fatty acids like we get from fish oils, because estrogen is an anti-inflammatory, and as it reduces, for some women, they actually say to me the symptoms aren't the hot flushes and the night sweats, it's actually the joint pains. And they feel like when they get up in the morning, they're creaking before everything sort of gets lubricated by the time they get to the bathroom. So omega-3s are our anti-inflammatories, and they're really important for our joints, but they also give lubrication to our skin, our hair, brain cells, really good research on Alzheimer's and memory, brain fog, everything like that. So for me, omega-3s are important, and they're classed as essential fatty acids because we can't make them in the body. We only get them from the outside in, food or supplements. And if a lot of women have done no fat or low fat diets, the likelihood is they haven't had enough of these omega-3 fatty acids. So it would be a multivitamin and mineral, omega-3, and the last one I would put in this sort of a maintenance program would be vitamin C, because as well as its benefit for our immune function, it's a powerful antioxidant, and it helps the body manufacture collagen, which is important for our skin, but also collagen makes up 90% of our bone matrix. So through the menopause and out the other side, one of our biggest risks is osteoporosis. So it's all about keeping our bones strong, keeping our brain functioning well, our joints, that lubrication, and taking us through this stage with also the aim on keeping us as healthy for as long as possible. So that's the benefit of the vitamins and minerals, and women on HRT could take all of those. There's no contraindication at all.
I better reassure everyone that in the transcript, there will be a full list of all of these if like you're going to use it as a shopping list for what can I do, whether I'm taking HRT or not.
Yeah.
And I'll invite my colleague, Sally Leach, to answer any questions that are coming through, because I can see there are a lot in the chat.
We've got lots of questions, so thank you everyone for, and also sharing as well, really appreciate it. And the main one was around herbs and HRT. There are times when, should it be one or the other? Can they be taken together? What considerations do people need to have around that?
And that's a really good question. And it really should normally be one or the other. So if a woman, for her, the HRT isn't working as well, then she needs to make the decision either to see the GP and change the brand or get a different make, get it through the skin rather than orally, or to come off the HRT, because if the HRT should be doing its job properly. And we're using herbs for those women who aren't taking HRT. And the only time we might use some herbs if they've seen their GP and they're weaning themselves off, and we may just use the herbs to help cushion that weaning process. But it's literally HRT or herbs. It's a choice of which route to go. Vitamins and minerals, they can be taken with HRT and should be, really, because the woman wants to keep herself healthy for when she's coming off of it, or anyway in terms of prevention into the future as well. So that's the difference with the nutrients versus the herbs.
Fantastic. There's a great question that follows on from that around what advice would you give for someone wanting to transition from HRT to a more natural approach? What would, or a herbal approach, what would you recommend if somebody wanted to approach?
Well, I'd suggest they see their GP and obviously talk about it and see whether they could over time. And I would say 3 months, and it would be better to do a bit of a weaning process. Maybe they could go down on the dose or some other way of taking it down. Otherwise, for women who've been on HRT a while, if they come off of it quickly, there can be withdrawal effects. It's almost like going cold turkey. And then the symptoms can be quite strong. And women have talked about this second menopause. And it's not really a menopause. It's just the effect of coming off the HRT quickly, and the symptoms may cascade back. So much better to see their doctor and ask about lowering the dose, whether they're going for a patch or a gel, whether it's something different, taking their time, at least 3 months to come off of it. And yes, during that weaning process, just for that short space of time, we might often use herbs as well, almost to cushion the effect of coming off of it. But normally, no, we don't mix HRT and herbs together.
Fantastic. And it comes on, we've got a few people asking about specific symptoms and herbs. So if I just talk through, so we've got somebody asking around what herb would you recommend for joint pain? Is there anything that can help with the
Well, joint pains, I would go, yes, there are some herbs that would be completely different to what we've talked about. And we're talking about things like olive leaf, even turmeric, things like that that are specifically on the joint pains. But it could be a symptom because of the normal anti-inflammatory effect of estrogen, and that's being reduced. And really the best thing to put in would be an omega-3 fatty acid supplement, because they are our main anti-inflammatories and they work really well, particularly if this is almost a menopause symptom of the effect of the estrogen declining.
Fantastic. And someone's also asked around any herbs where someone's struggling with overwhelming fatigue. And again, I know this may be more a nutrients or supplements.
Yes, and I would say again, see the doctor, because it may be that they're anemic, there may be a thyroid issue going on. So there may be an underlying cause that's actually driving the fatigue that could be treated. It could even be a vitamin B12 deficiency. Also, a lady recently in the clinic, the fatigue was actually coming from a vitamin D deficiency. And that, once she'd corrected that deficiency, it was just like this fatigue had lifted. So all the time in nutrition, we're trying to find the underlying cause. And if we can address that, it can make such a difference, because it's actually solved the problem in that sense. So I'd see the doctor and just rule out anything medical. A multivitamin and mineral could be good as well, because it would be giving her a bit of everything in just to make sure most of the nutrients are covered. But testing in that situation, especially if the fatigue is overwhelming, could be really useful.
Absolutely. And people have asked around the hops and milk thistle, kind of asking how do they use them?
Well, again, I'd suggest always do a combination. So there's Agnus castus in there, black cohosh, hops, milk thistle, because they're all working slightly differently, but synergistically together. So I'd suggest a combination rather than just going for milk thistle on its own or even hops on its own, because it's the milk thistle is really working more on helping the liver to detoxify hormones rather than addressing symptoms.
Okay. We've had someone ask around that they've been told they weren't suitable for HRT because of they're experiencing endometriosis. And are there any contraindications with herbs and endometriosis? I know you mentioned a little bit around PCOS and endometriosis and the impact that they could have.
Yes, no, it would be fine with the herbs I mentioned, and Agnus castus could be really helpful, and also particularly the omega-3s for endometriosis, because there can be a lot of pain, inflammation going on, and that's, you know, one of the major symptoms. And because endometriosis and fibroids are driven by estrogen, women with those conditions really do have to be careful about going on HRT, because the estrogen will be feeding that estrogen sensitive condition, and then obviously could make that problem worse. But as we're going through the menopause and the estrogen is declining, those conditions can almost be taking care of themselves. The tricky bit, and HRT would often be contraindicated in that case, because it's putting estrogen back in again. What we haven't mentioned, and often is useful with something like endometriosis and fibroids, are actually probiotics, the beneficial bacteria, because as well as the liver doing its job to metabolize estrogen into a harmless form, it's the beneficial bacteria that help pull that excess estrogen out through the bowels and the digestive system. So not only do we detoxify estrogen, but we also eliminate it as well. So our beneficial bacteria are important too, especially at this age and stage in our life.
Fantastic, thank you. Just got one final quick question just to try and squeeze in. I know we've not necessarily covered absolutely everything, but we've tried to cover the majority of things coming through. Any herbs for sleep or any recommendations around sleep? Because we know sleep can be a challenge during this time.
Yeah, there are some really good herbs for sleep. Have a look on Natural Health Practice, because there's a really good sleep support that I formulated. Things like valerian, chamomile, all are really helpful there. Tart cherries, we've got some really good evidence in the medical literature, lemon balm. So there are some really good herbs that help with sleep. And again, combinations, and even in the medical literature, they've actually shown that certain combinations of the herbs are better than taking them singly. But obviously with sleep, we're also thinking, you know, could there be too much caffeine going in, eating or drinking at the wrong time of day? So something may be going on with blood sugar balance that may be causing more of the stress hormones to be released that's affecting sleep. So oftentimes it's just looking at somebody as a whole person to see what may be the underlying cause. And if we can address that, then they've got a long-term solution and probably wouldn't need the herbs on the long term. Yes, vitamins and minerals, essential fats, I always feel are important long term, but the herbs are really just to solve a problem at the time. And once it's solved, it's usually solved.
Fantastic. Thank you very much.
Thank you very much. As you say, Sally, we could probably talk for another 2 hours about this. And to reassure everyone, we will make sure we put a list and a link in the transcript, so that if you're like me, and I did start taking notes and then gave up. So it will be in there, and we will of course give you the recording of this and the transcript again. So thank you very much. I have to say, Dr. Marilyn Glenville, whenever I see you, you are always so full of health and vitality that clearly you're doing something right.
Yes, Deborah, I keep taking the tablets, as they say. Yes, I do. Yeah, it is. I do take a multivitamin, mineral, omega-3 and vitamin C, and I take the Meno support for around the menopause. That's my multi. So yeah, I'm trying to walk the talk and talk the walk, both of all of those.
I think you do a great job of it. So thank you very, very much, everyone, for joining us today. And we look forward to the next Lunch and Learn. Thank you very much, everyone.
Thank you.